So I have a couple of notes here that I want us to get into very briefly. First, let's look at what your physiological response is. This is your body's response to stressors in your environment. Your body's response, which means your body can maybe have an increased heart rate. Your body may respond with an increase in blood flow. Your body may respond through muscle tightness. That's why a lot of individuals that suffer from anxiety often feel the need to do relaxation techniques, mindfulness therapy, things like that. Your kidneys as well. Oftentimes when we are in stressful situations, your kidneys will actually release adrenaline. And this is why sometimes when you feel anxious, you have to use the bathroom often. So it actually affects inside your digestive system, your stomach. All of these things are physiological responses. And what's common in all of these is that they are involuntary. What does that mean? You are not telling your kidneys to release adrenaline. You're not telling your heart rate increase. These are things that are happening as a result of your environment. Your body is detecting, your mind is detecting. They're both communicating with one another. So your brain and your mind is maybe saying, you know what? We smell something, or when we talk to this person, there's something that is triggering us. There's something that's making us uncomfortable, whether it be what we're seeing, what we're listening to. Is it their increased tone, right? All of these things communicate with each other, your brain and your body, to help you make decisions and help you react. So that's the first way to actually know and understand, are you feeling anxious or uncomfortable in a situation? If you find yourself maybe talking to someone and you notice that your heart rate is increasing, you notice that you're sweating, right? Sweaty palms. Maybe you start to feel a little bit dehydrated. You notice that you have to drink a lot more water. If all of these things are happening in a conversation with someone, it might be someone that you don't feel entirely comfortable with or safe with. Right? Maybe you're kind of constantly looking over your shoulder, thinking that you need to prepare. You might be honestly trying to flee the situation. Your body might be in a position that's geared away from that person. So that's already another thing, looking at your body language. How is your body language with that person? These are all things that will help us understand that we are actually starting to feel uncomfortable, which can cause us to delay or not react as well, right? So if we can catch it before we actually end up reacting, then that'll help us more in the long term, rather than first looking at, okay, I just need to control my anger. I just need to control my actions. No, let's actually look at why you're reacting that way. Let's look at how you know if you're feeling uncomfortable and how that can cause you to maybe react in a certain way.